Welcome to the National Diabetes Prevention Program, Lifestyle Coach Requirements and Responsibilities webinar, brought to you by the Centers for Disease Control and Prevention's Diabetes Prevention Recognition Program, or DPRP. The purpose of this webinar is to go over the requirements and responsibilities associated with being a lifestyle coach trained to deliver the National DPP Lifestyle Change Program per the DPRP Standards and Operating Procedures, also known as the DPRP Standards. What is a lifestyle coach? CDC's DPRP relies on lifestyle coaches to implement a CDC-approved curriculum designed for effective lifestyle change for preventing or delaying type 2 diabetes and for providing support and guidance to participants in the program. In delivering the Lifestyle Change Program, a lifestyle coach will carry out multiple roles and responsibilities. The roles and responsibilities most common for lifestyle coaches are using a CDC-approved curriculum to deliver the program, motivating participants, creating a friendly environment for group discussion or interactive learning, whether in person or online, and leading lifestyle change program sessions and makeup sessions. To ensure quality, CDC requires all lifestyle coaches to be trained by 1, a training entity with a signed Memorandum of Understanding or MOU, agreeing to train using a CDC-approved curriculum and to provide training nationally or regionally to organizations recognized by CDC, which are listed on the National DPP Customer Service Center. 2, a private organization with a national network. 3, a CDC-recognized virtual organization. Or 4, a master trainer who completed a master training program with a training entity holding an MOU with CDC. To be a lifestyle coach, you must receive at least 12 hours of training from an MOU holding training entity, which can be broken up over the course of 2 days. Additional maintenance trainings and webinars. In addition to the initial 12-hour training provided by an MOU holding training entity, or in another manner specified in the previous slide, lifestyle coaches must also complete at least 2 hours of advanced coach training each year. Advanced coach training is training beyond the required formal training for lifestyle coaches that builds on the foundational skills necessary for helping participants make effective lifestyle change and limited to trainings provided by training entities that are listed in the National DPP Customer Service Center. These 2-hour advanced coach trainings build on the foundational skills learned during the 12-hour sessions and are necessary for helping lifestyle coaches lead classes effectively while employing important skills such as motivational interviewing, health equity practices, and National DPP best practices, among a few. Typically, these advanced coach trainings carry a fee that is rendered by the MOU holding training entity. CDC will occasionally offer CDC-sponsored webinars on specialized topics such as program delivery, data submission, and transitioning to the revised DPRP standards, which could also count as advanced coach training. These webinars are free to CDC-recognized organizations and are available on the National DPP Customer Service Center as needed. Lifestyle Coach Requirements, Session Delivery. Once a lifestyle coach is successfully trained in a manner specified in the DPRP standards, they are prepared to begin to deliver the year-long Lifestyle Change Program. To deliver the program, lifestyle coaches must adhere to a CDC-approved curriculum with the required intensity and duration described in the DPRP standards. This curriculum is designed to help coaches support participants in making effective, meaningful, and sustainable lifestyle changes. In delivering the program, lifestyle coaches should consider methods to achieve intended session outcomes. Some CDC-recommended strategies included are using motivational interviewing and creating a friendly environment for group discussion regardless of delivery modality, making learning a shared objective and promoting peer-to-peer learning to help program participants connect with one another, helping participants problem solve to support and encourage participants on their way to achieving their goals, and encouraging participation during sessions to foster a commitment to effective lifestyle change. Lifestyle coach requirements, participant support. In addition to making sure sessions are delivered effectively and with upfront preparation, lifestyle coaches are also expected to serve as the primary support for the participants in their cohort or cohorts if teaching more than one class at a time. Lifestyle coaches should prepare for each session by reviewing the lesson plan, determining the session content needed based on the lesson plan, and reviewing participant food and activity trackers from the prior session. Lifestyle coaches also support participants' preparation by making session reminder calls or messaging the cohort about the session date, time, and objectives. Additionally, lifestyle coaches should support efforts to prepare data for review and submission to CDC. By engaging in this process, lifestyle coaches will have better insight into participant performance and will be able to monitor participant progress more closely to address any issues that might improve outcomes. For more information about the support a lifestyle coach can provide for data preparation, please review the information detailed in Table 4 within the DPRP Standards. Finally, a lifestyle coach's support for participants does not end in the classroom or in preparing data. Lifestyle coaches are also encouraged to be accessible to participants to answer questions and to help them apply lessons learned in the classroom in their daily lives. Additionally, for those participants who are unable to make a session, lifestyle coaches should follow up to schedule makeup sessions to ensure all participants complete the program at the same time. Lifestyle coach requirements, compliance. Lifestyle coaches must be familiar with and comply with all applicable laws and regulations, including those governing participant privacy and data security. For example, the Health Insurance Probability and Accountability Act, or HIPAA. Protecting participants' personally identifiable information, or PII, is a high priority for CDC, and lifestyle coaches should always adhere to the highest levels of data security. Additionally, organizations seeking reimbursement for the Medicare Diabetes Prevention Program, or MDPP, will need to obtain a National Provider Identifier number from the Centers for Medicare and Medicaid Services for their lifestyle coaches. To fully participate as an MDPP supplier, lifestyle coaches must include this NPI number as their coach ID in data submissions, but this will be covered further in the next slide. Lastly, lifestyle coaches must complete required organizational trainings, required refresher or advanced coach trainings, and optional trainings offered by CDC, such as DPRP-sponsored webinars, to be compliant in the National DPP. Ensuring lifestyle coaches are properly trained leads to greater program success and helps participants walk away with better health outcomes. Accounting for lifestyle coaches in data submission. While not an explicit responsibility of the lifestyle coach, organizations should take care to accurately capture lifestyle coach information through the data submission process. The primary method for capturing lifestyle coach information is through the coach ID variable in the National DPP, DPRP Data Collection Comma Separated Value, or CSV spreadsheet template. The coach ID indicates the coach leading the cohort. It is a variable that is uniquely assigned and maintained by the applicant organization and must not contain any PII. As mentioned on the previous slide, lifestyle coaches who deliver the MDPP should use their NPI numbers in place of their coach IDs. At CDC, we recognize that there may be more than one lifestyle coach leading a cohort. This is a great way to ensure participants are supported throughout their time in the program. However, if multiple lifestyle coaches are facilitating class sessions, please choose only one coach to enter. This will help reduce errors in the CDC data evaluation process. Additionally, each coach ID entered in the CSV spreadsheet must match a coach ID entered in the coach section of the organization profile module. Organizations can change profile information at any time by accessing their profile through the DPRP Data Submission Portal via the Secure Access Management System, or SAMS, or by contacting the National DPP Customer Service Center. Finally, the value for Coach ID is expected to be the same for each participant record in the CSV data file unless the participant attends a makeup session taught by another coach or a new lifestyle coach permanently replaces a coach while the cohort is running. This concludes this presentation. Thank you for participating in the Diabetes Prevention Recognition Program. Whether you need technical assistance or guidance in making program adjustments or have questions about any part of the DPRP, please reach out by visiting the Customer Service Center at nationaldppcsc.cdc.gov and submitting a technical assistance request. To submit a request, you will need to complete a brief profile by selecting Login and then Register. Once logged in, select Contact Us, Contact Support on the homepage. Thank you, and remember, CDC is always available to help guide and support you.